One of the syndesmotic tests that we haven't covered yet is the fibular translation test. And this is actually a pretty good test for both sensitivity and specificity. So it's good at ruling in and ruling out these injuries. And it can also help you look at fibular fractures as well. And there's two ways to do it. One of the ways that you can do it is starting lower at their ankle and assessing going up. Oftentimes I'm going to start high and then work down, but it's fine to do it either way. If you're going to have a syndesmotic injury, the injury typically starts down here at the ankle. And the other thing that I would say is, and Brooke and I were talking about this before we did the video, it's okay to not put a pad or a towel or something underneath them, but then they're going to be really like contracting muscles and or putting a lot of varus stress on their knee as their lower leg hangs down, which can be uncomfortable for people. So it's a good idea to put a bolster or something underneath their lower leg, so that way they're able to relax enough for you to be able to do this test. If in a pinch you can't do that, you could put your knee underneath or just try to get through the test really quickly. But in general, all you're gonna do is have them be relaxed, and then you're going to put your thumbs, or I use my thumbs, and put them on the posterior aspect of the fibula and just do an anterior translation. And then I'll take my index finger and my middle finger and do a posterior translation, or I can also just do thumbs on both sides and I'm pushing posteriorly and then I'm pushing anteriorly. Now just know, if you're pushing straight on their ligaments and their ligaments were hurt, it doesn't matter if they're loose or not, it's gonna hurt because your fingers are there. So you can also do this higher on their fibula. You just have to make sure that you're on their fibula. So you would feel this bone on the side and then kind of roll off the side. And once you know you're on the side, you can do a posterior mobilization of it, and then you can do an anterior mobilization. Oftentimes I start up on the fibular head. So as you come here, you're gonna feel this knot that's just below the joint line. And again, you can do an anterior translation and a posterior translation. And oftentimes I'm using my thumbs because I can get down underneath there easier to be able to do these. And again, if they are intact and they don't have any damage, you shouldn't feel a lot of motion. But I've had some individuals, athletes, who have completely torn, so grade 3s, nothing left, of their anterior and posterior inferior tibiofibular ligaments, and then torn their syndesmosis all the way up to their superior two ligaments. So when they were weight bearing and walking, they would actually feel their fibula snap back and forth in and out of the fibular groove that's on the tibia. And you could hear it would be like clicking. And so when we did MOBs on them, or this glide test, their fibula would move like gross movements, and it was very painful for them. They did not appreciate this test at all. So if you're down on the very distal fibula, you should be able to do this test because you're over the lateral ankle ligaments. If you go a little bit higher to where it's level with the tibia, now you're at your inferior tibiofibular ligaments, and that's going to be a lot more tender. And I also brought up fracture tests. If you do this on somebody who has a fracture anywhere along the line of their fibula, you may or may not cause motion to occur depending upon if it's a full fracture or a stress fracture. But if you feel crepitus, popping, anything like that, same things that we talked about with the squeeze test and those kinds of things, then this would also be a positive test for a fibular fracture. And I know the sensitivity and specificity isn't listed for that because technically it's not considered a fracture test, but you can use it in that way as well. And so just throw that in your toolbox.